My name is Steve Panelat. I'm the chief of the Division of Palliative Medicine at UC San Francisco. My start in palliative care was really during the AIDS crisis. So I arrived in San Francisco for medical school in 1985, so right in the beginning years of the AIDS crisis. I spent a lot of time working at San Francisco General, both as a student and a resident, and we took care of a lot of people with AIDS at a time when there were no treatments for the disease. And many, many young people, many young men were dying of AIDS, and there was nothing we could do. Except there was something we could do. And what we did was really important, is to support people with AIDS, to really create a community for them, to relieve as much of the suffering as we could, to negotiate goals of care, advanced care planning, to reconcile families who often arrived in San Francisco to find that their son was dying and gay and didn't know that. There was a lot of sadness, a lot of tragedy around that. It was also a time when we really learned about how the caring and healing could happen even if we couldn't cure a disease. And that was really my introduction to palliative care. We didn't call it palliative care. We didn't have a name for it. We didn't know that that's what we were doing. But as I went on in my career and then ultimately joined the faculty at UCSF, I suddenly learned that there was a name for this care that we did and found it incredibly gratifying. When I was at UCSF for my training, we had no palliative care. I'd never heard the word. There was no way to train in it, and yet I had learned it. And it was once I joined the faculty that I then learned about the Project on Death in America, which was a faculty scholar program to train leaders in palliative care. And I applied for that as a young faculty member, and that's where I got introduced to this community of leaders. And it was similar to the CAPC experience of walking into a room and just seeing all these people who also thought palliative care was worth a career, and it was worth working on and being involved with and wanting to lead in. And sort of after that, that's the time when we worked with a team to develop the palliative care program at UCSF that we launched in 1999. And honestly, after that, really never looked back.